Hello, we are here at the GreatHER Purpose Podcast, and I'm your host, Sharah Nicole. And today I have a dear friend of mine, Dr. Leah McMillan, who is, I'll let her introduce herself, but she covers a lot of topics that deal with mental health, emotional health. And today we're talking about those topics today on the GreatHER Purpose Podcast and YouTube channel. So I want to thank you, Dr. McMillan, for coming. Thank you so much for being here.
Thank you so much. It is a pleasure to be here.
Awesome. So I want to, before we got into the questions, I want to ask you, I know you outside of this, but I want to ask you, what sparked your interest in this field of work?
So really, honestly, I just wanted to help serve other people. I wanted to empower and encourage other women and men and teens and children. But ultimately, I just want to be a light in the darkness. I think that we need more individuals out there, that we all can be the light in not only our darkness, but someone else's darkness.
Right. Awesome. And with that being said, you started working for yourself. When did you start your own business with this?
So I started EnSpire Counseling and Wellness. I'm not only the founder, but I'm also the owner and a licensed clinical marriage and family therapist, along with being a certified first responder counselor. We opened EnSpire Counseling and Wellness February 2019, and God has blessed us tremendously.
Awesome. I know that one of the things that you all cover with your services, and this is something you're very passionate about, is mental health. And with that being said, what do you consider to be the top 3 strengths and weaknesses in terms of individuals seeking mental health and therapy?
So I would say the top 3 traits that someone that's seeking therapy, seeking counseling, seeking psychiatric services, the absolute first trait is courage. I think it takes so much courage to seek help, to say, you know what, I'm really struggling doing this by myself, or I have utilized resources, but I'm still just not there, not meeting my goal, my personal goal or academic goal or marital goal, relational goal. And so just the courage to seek therapy out. I also think that individuals that seek counseling, they're resilient. You know, they're coming in and they're trusting us. They're trusting us with sometimes really difficult situations and events, traumatic experiences in their life. And for most, we're complete strangers. You know, they may have heard about us or heard about our center, but they're coming in and they're really being vulnerable. And so I think that takes a lot of resiliency. And then I think that our clients are amazing. I think they're motivated. They're motivated for change. You know, they want to see change not only in themselves, but also their family relationships, their community, and the world.
Right. And with that being said, being on the other end of that, being a therapist, being someone that the client does not know necessarily, what are some of the things that you feel are important traits for, your employees to have when dealing with those, dealing with clients in general?
So I definitely think, or I hope, that we're good listeners. We need to listen twice as much as we talk. I feel that God gave us 2 ears and 1 mouth for a reason. I also think that therapists need to be compassionate. We need to empower. We need to encourage. I absolutely feel that therapists need to be respectful of differences and cultural differences in ideologies, differences in family systems. I think we need to be open-minded that what may work in our family may not look the same in someone else's family, and creating an individualized treatment plan for either that individual individual, that couple, or that family. And then also maintaining healthy boundaries. We've got to be able to maintain those healthy boundaries with our clients. Our clients are coming to us for a service. They're coming to us because they look at us as being experts in the field. So we have to role model those healthy relationships, and that comes with boundaries. And then most important, we have to create a safe place, a safe environment for people to open up. Again, people are talking about things that they experienced that were out of their control, traumatic experiences that shifted their family unit, things that it's very difficult to process through, and they're trusting us with that. And so creating that safe environment where they feel that we are listening.
Right. And with that being said, do you think in your field of work that maybe there's a misconception about seeking mental health, or even professionals with that? Because I know in my culture, mental health is just something you just don't talk about that often. You don't really address it. So what are some barriers, and how can we overcome those barriers with people seeking mental health services and support?
So I completely agree with you. I do think that we have a lack of some resources. I think there's a stigma still attached to mental health. However, I do think that we are decreasing that stigma. One of the great things about this generation is they are so open-minded. They're transparent to talk about going to counseling and therapy. They don't hide it like some of the older generations do and so forth. So that has really helped. I do think that we're talking more about mental health now because of the pandemic. People are really struggling, and we have seen an increase in needing mental health resources, needing trauma specialists, needing those therapists that can work very complex cases. So I think some of the barriers for people seeking counseling is exactly what you said. It's cultural. In a lot of different cultures, they're raised, and families talk about what happens in the families, stay in the family, right? Mm-hmm. That you're weak if you seek help, or you're betraying your family members if you talk outside of that family unit. And so it's really getting in there and educating, preventing, talking about how we're not there to change cultural beliefs, differences, ideologies. We want to work together. I do think that, finances can be a barrier for a lot of individuals. I think that, benefits as far as insurance can be really difficult for a lot of people. I think it's still more difficult for people to seek counseling, seek specialty services than it is to go to a primary care physician. And that's where we've got to change things. And that's how we can make changes in the system for everyone to look at mental health just as important as physical health. That's really one of my taglines besides EnSpire Cares is mental health is just as important as physical health. Are you investing in your overall wellness, which includes physical, psychological, and spiritual? I also think that for us therapists and practices, we need to be more open and more flexible in the services that we offer, the fees that we offer, the ways that we offer those services. And I think we need to provide those services and sometimes and off times and days. Like our practice stays later than some practices. My clinicians work at least one Saturday a month. And we do that because we want to be able to meet the needs of our community, regardless if that's children or teenagers not wanting to miss school, if that's school teachers that can't miss work and they have to come, outside of work, or professionals like yourself that need to come in the evening. So I think it's also us looking into what can we do to change the system and modify the system in such a way that people feel comfortable coming in and they see that we're investing in them. We're investing on them being the very best version of themselves.
So meeting them where they are, basically.
Exactly. Perfect.
Awesome. So with that being said, where do you see your practice EnSpire in the next 5 years?
So I hope that we continue to expand our services here at EnSpire Counseling and Wellness. In just 2 years, we have grown to 5 full-time clinicians who are all EMDR trained, who are all trauma specialists. We have a registered play therapist. We have specialists in CBT, DBT, trauma-focused therapy, EMDR. We also have a psychiatric mental health nurse practitioner, so we can offer psychiatric evaluations and medications. We have a licensed neuromuscular massage therapist that works with us. We can refer for nutritional counseling, speech and occupational therapy. And so we just want to continue to expand our services to continue to really voice that we need to work on improving the overall person. I would love to see, and I'm hoping in the future that we can also expand our group therapies. We are offering different groups, different themes of groups throughout. I'm hoping to really continue to improve virtual. We do include virtual counseling and telemed, and we've done that and we'll continue to do that regardless if we continue while we're in the pandemic, but also afterwards. We've reduced our rate for people that are in need or that are struggling and so forth. We are looking to expand some classes for co-parenting classes for those divorced parents or separated parents that need to learn and want to learn how to continue to co-parent even though they're no longer in a relationship. 3 of my clinicians are trained specifically in co-parenting. And then offering just additional educational resources, consultations. Again, we want the community and everyone to know that your health is important and your health also includes mental health. And so you said it perfectly, meeting them where they are, whatever they're going through.
And you had said something a few minutes ago about you offer, what kind of services do you all offer right now currently?
So we offer individual, family, couples counseling. We can see ages 2 all the way up. We can see pediatrics, adults, and geriatrics. We also do offer group therapy. Due to COVID, we are running very small number groups, and they're meeting at at different times and so forth, just so we can make sure that we protect not only our clients, but our staff members. And we're looking into hopefully being able to offer some virtual online groups. We offer neuromuscular massage therapy, also regular massage therapy. We offer EMDR trauma therapy. We offer first responder counseling for our first responders in the medical field, military, law enforcement. And we also offer co-parenting, again, for those families who are separated or for those parents that are divorced that want to learn how to improve their relationship in order to co-parent for the sake of their children. We also can refer for nutritional counseling, speech and occupational therapy, and mediation. Right now, prior to COVID, we held restorative yoga every single week here, but we have had to stop restorative yoga due to the constraints with COVID, but hopefully we'll be able to start that soon. So we just offer a wide variety of counseling and wellness services all under one roof.
Awesome. And I had another question. So with the different services you provide, one thing that I've seen come up a lot in different interviews I've done, even in the media, you hear a lot of talk, not only mental health, but anxiety. And I want to ask you specifically about anxiety because I know that I've heard a lot of it when I used to work in the school system. I hear a lot about it in the type of work I do now. Why do you think anxiety is such a focus now versus maybe 6-7 years ago?
Well, anxiety is now the #1 mental health disorder.
Okay.
So a lot more individuals are recognizing that they're anxious, that they're stressed, that they're overwhelmed. And we're also talking more about the physiological responses and symptomology that comes along with the psychological symptoms. Most of the time, anxiety comes from feeling out of control. Either something has happened in our life that was out of our control, or we fear something is going to happen that we don't have control over. It also absolutely can be chemical. It can be genetic or hereditary. I also think that more and more people are adding pressure to themselves. They're overwhelmed. We're working multiple hours. We have a lot of expectations. These kids, they're learning now at a much faster pace than we ever did. And those expectations create a lot of anxiety. I think that the pandemic has really opened everyone's eyes to anxiety, because those that suffered from anxiety prior to COVID, they're like, okay, now you finally get it. But those individuals that didn't struggle maybe with anxiety prior to COVID, they're feeling it. They're feeling anxious. They're feeling overwhelmed. They're experiencing significant loss. I really don't think that, I think that now people are recognizing, but I don't truly feel that we really understand or can grasp the mental health pandemic that has started and that will continue due to COVID.
Right. Well, I've thoroughly enjoyed talking to you, Leah, all the time. You're such a ray of light all the time. Even though this is a serious subject, you still have such a great energy about yourself since the day I met you. And I just love that about you. But before we close out, I want to see if there's anything else you want to add. Like, where can people get more information about EnSpire Counseling? How can they reach you? And just anything else you might want to add as far as the work that you do?
Well, they can, first of all, they can contact our office directly. Yes, we take referrals from referral sources such as pediatricians, primary care physicians, pastors, but you do not have to have a referral. Anyone can call themselves to schedule an appointment. We can see anyone in the state of Georgia. As far as our wellness services for medication management, massage therapy, nutritional counseling, those besides counseling, anyone in our community can utilize those services without being a counseling client. We don't want to hinder people. We want them to come in and receive the services that they need. If we are not the right fit, we're going to find the right fit for you. We want to help you achieve your personal goals. So they can call us directly at 229-262-1000, or they can check out our website at www.inspirecounselingandwellness.com. And EnSpire is with an E and is spelled out. We also have a Facebook page, an Instagram page. We have a YouTube video and a LinkedIn page. So you can find us. And I will say, for the last thing, everyone always asks why we spell EnSpire with an E. EnSpire with an E is the old Middle English spelling, which means to breathe and to be calm.
Oh, I love that. That's awesome. Awesome. Well, I do have one more question. So when should individuals seek maybe some input that if they are seeing signs of not maybe anxiety, but maybe a mental health disorder or anything like that, when should they start being alarmed that maybe they should go and see someone?
So how I look at counseling is like going to the dentist. Sometimes you're going to go and you're just going to need a routine cleaning. And then sometimes you're going to go and you need a root canal. So, of course, we're always here in a crisis situation. We're always here when something traumatic happens or a tragedy. And truthfully, that's usually when most people seek out counseling, when something so distraught has happened that they're not sure what to do next. But I also feel that counseling can be preventative. When things start to change, or there are going to be upcoming changes like a move or a graduation or empty nest, or you're not quite sure what's going on medically or physically, that's when you can seek counseling. You can go ahead and create a roadmap then and there, just in case things pop up. For some people, they come in and it's just brief therapy. They come in for 3 or 4 sessions. They get what they need, they achieve their goals, and they're on their way. And then we have some that come in every week for a significant period of time. Some that are seen for maintenance, where they can go literally months and then something pops up and they come back and they see us. So it really is up to the individual person. But I always believe in being proactive and not reactive. We don't want to wait until we have strep before we go to the doctor. We go to the doctor when we start to have a sore throat. I feel like mental health is the exact same way. When we're experiencing changes, we're struggling with some adjustments, we just have increased stress, maybe we're just not as happy as we were before, or we start truly having some physiological symptoms. Sleep disturbances, headaches, nausea, suppression of appetite. That's when we need to seek help.
Awesome. Well, again, I've enjoyed talking with you. I think this is such an important subject to talk about, and hopefully we can talk some more in the future about different things related to your services. But thank you so much for this interview and the opportunity to speak with you, Dr. McMillan. You are an amazing person. I just love the work that you're doing. So thank you so much.
Thank you. It was a pleasure. You're doing amazing work too. Bye.
Bye. Thank you.